The purpose of this study that I researched was to observe the effects of music therapy on patients who have had an ischemic stroke, specifically on the effects it had when paired with physiological therapy for motor, speech, and autonomic functions. There was no specific sentence in the article that described what would be expected outcome of the experiment, but reading the introduction, it can be gathered that the authors believe that musical accompaniment would help in the rehabilitation of motor, speech, and autonomic functions in people who have had ischemic strokes that damage their right hemisphere. In this study, 45 patients were chosen, 20 of them being men and 25 being women that were aged 73.2 with a standard deviation of 5.4 years, who have had an ischemic stroke in the basin of their right middle cerebral artery. Standard therapy had been administered to all the patients previously. These patients were chosen because right hemisphere damage can cause issues with autonomic functions, thus being a specific interest in the study. 15 patients were each placed in 3 groups, Group 1 being the study group and Group 2 being the reference group. The last group was, of course, the control group. Both the study group and the reference group were treated on the 3rd, 5th, 7th, and 9th day of the treatment period, and a set of exercises was used to rehabilitate the fine and gross motor functions as well as speech. The synchronization of cardiorespiratory was also examined to see whether it improved with music therapy. The music used as rehabilitation was delivered to participants in a secluded location measuring 20 meters, and it was separated and paired with receptive, active, and integrative techniques. The music therapy sessions were organized into 3 parts. The first part used the receptive technique in order to decrease neuropsychological tension. The song used in the first part of the session was The Swan from Carnival of the Animals, including cello and piano sounds. It was also played in dim lighting. The second part of the session used a form of the active technique with Schubert's Ave Maria, with extended vowels and consonants, as well as piano, alto, violin, and contrabass sounds, played in bright lighting. The last part of the session used the integrative technique by using multiple rehabilitation exercises while playing Festive Overture by Shostakovich with bright lighting. Regarding the rehabilitation of fine motor functions, several exercises were used, using clothing's pegs, picking up coins, flipping over a paper card, threading beads, etc. Gross motor functions were mended with physiotherapy. Cardiorespiratory synchronization was aided with beating out the rhythm of a song while listening to the triumphant march from Verdi's Aida, or Tchaikovsky's March of the Wooden Soldiers. The status of rehabilitation in the patients was tracked with the NIHSS test, the Rivermead Mobility Index, the Action Research Arm Test, and the Modified Speech Function Assessment Scale on the 2nd, 4th, 6th, 8th, and 10th day of rehabilitation. Also, cardiorespiratory synchronization was observed using a VNS Spectre instrument. The tests conducted to track improvement were, as stated above, the NIHSS test, the Rivermead Mobility Index, the Action Research Arm Test, and the Modified Speech Function Assessment Scale. Cardiorespiratory synchronization was observed using a VNS Spectre instrument. Within group differences were found using the Wilcoxon test, and differences in independent groups were found using the Mann-Whitney test. A summary of the results. The initial results of the NIHSS test on day 2 of rehabilitation averaged 5.8, 5.7, and 5.8 points in all 3 test groups. The Rivermead scale averaged 3.9, 3.9, and 3.7 points, and the ARAT test averaged 26.1, 25.8, and 26.3 points. The speech function scale test yielded averages of 69.9, 69.3, and 70.1 points. Results indicated quicker recovery of patients who received sessions with music therapy starting on day 8 of rehabilitation. There was a significant change on the NIHSS test in the control group on day 10. Using the Rivermead scale, gross motor improvements were observed and were seen to have improved by day 4 of the rehabilitation process. On day 10, 87% of all patients could climb a set of stairs with no assistance. The results of the patients in the study group who received physical therapy as well as musical therapy indicated the rate and results of improved motor function was significantly better than in the other 2 groups, with P being less than 0.05. It was seen that the rate of recovery in patients working with music and physical therapy was significantly greater in fine motor functioning according to the Rivermead scale. Rather than recovering fine motor activity by day 6 of the study, it was seen in the control group to happen by day 10, according to the ARAT test conducted on days 2 and 10, with P being less than 0.08. While speech improved for all patients as early as day 4 of recovery, it improved faster in patients who also received musical therapy, with P being less than 0.05. The first conclusion drawn from the test was that the NIHSS test was not sufficient in comparing the effects of restoration measures in each group. Other assessments were conducted to measure neurological deficits in gross and fine motor functions, such as the River-Mead scale, the ARAT test, and the SFS scale. The fact that restoration in fine and gross motor functions in the study group occurred from day 6 can be explained by the fact that the exercises used to improve fine motor functioning and speech is demanding and energy draining. But with music, the positive psychological load was supplemented as well as the physical potential was stimulated over time, making it easier to complete the task over the course of the restoration period. Over the course of time for the reference group, though, they became more exhausted from exercises for fine motor and speech improvement. The task used to increase gross motor function was tolerated well by all patients in the design. However, the study group showed improvements earlier in the study according to the River-Mead scale, which could give more evidence for the positive effects of music therapy paired with physiological therapy. Cardiorespiratory synchronization was also observed throughout the rehabilitation period. Between group differences were seen on day 6, showing the effectiveness of cardiorespiratory training, especially if accompanied with music. The marked decrease in cardiorespiratory desynchronization in the study group and minor decrease in the reference group continued on minor decrease in reference group on day 8 can indicate the success of CRS training. In the control group, patients at day 10 continued to have slight impairments to CRS, indicating that no music therapy had an effect. This data can lead to the conclusion that music can have positive effects on patients with IS when paired with physiological programs. This study can lead to wider use in clinical practice.